Bafetimbi Gomis spent the night in hospital for further tests after he fainted on the pitch during Swansea's 3-2 defeat at Tottenham. We can get more on this now and speak live now to cardiologist Dr. Boon Lim. So much for joining us. First of all, can you just explain the effects of the condition that Gomis suffers with?
So my understanding is that Mr. Gomis suffers from a condition called Vasovagal Syncope. This is a condition that is related to a low blood pressure and possibly a low heart rate. And what happened on the pitch, from what I've seen from the clips that I've seen on the news, is that he had a period of lightheadedness and then fell onto the ground on all fours, remaining conscious, but I assume at that stage was getting more and more lightheaded before he passed out completely. Now, I don't know exactly how long he lost consciousness for, but certainly when he recovered, he appeared to be fully recovered within a very short space of time.
Now, Gomis said that he's been suffering from stress lately. Is stress something that can trigger a condition like this, or what else can trigger something like this?
So stress is clearly one of the major precipitating factors for vasovagal syncope, but I understand as well that he had some stress related to his father being quite unwell and his concern for his father. Now, in these situations, typically people are not sleeping very well at night, possibly being a bit dehydrated, and when you come on the pitch in that situation where you have these risk factors stacking up like ducks in a row, then you have the tendency for vasovagal syncope. So clearly, mental stress, physical stress, coupled with a bit of dehydration, lack of sleep, and possibly the state that he was in with the anxiety in relation to a game could all be provoking factors for vasovagal syncope. Yes, so stress could certainly play a major role in precipitating this condition.
Now, we know that he's fainted on the pitch on 3 other occasions in his career. How dangerous do you think this is for his future health?
So vasovagal syncope is typically a very benign condition. In his case, I'm not exactly certain what the previous conditions were that led to his vasovagal syncope attacks. It's certainly considered an attack which is very self-limiting. That is, a patient faints, gets to the ground, and typically when you're on the floor, you have increased return of blood back to your heart that returns your blood pressure to a more normal level. And that generally relates to, then translates to a patient who recovers from the vasovagal episode. And recovery is usually very quick, within a matter of seconds, and complete. So there's no other, if you like, long-term residual effects from the vasovagal episode that he had. This is one of the most common conditions that we see, particularly in the young population, undergoing stress, and the risk factors which I've talked about previously, including dehydration, and in these situations, people have a tendency to faint. This, for example, can also occur in other stressful situations, such as being on a crowded underground carriage on the tube on the way to work, which is one of the most common reasons where I see patients in my clinic who have had a faint, for example, at work or on the commute on the way to work in a warm, hot, crowded environment. Typically, I think it doesn't translate to any long-term ill effects for patients, especially if they continue to hydrate and are aware and acknowledge what the triggers potentially for the stressful response triggering vasovagal syncope.
Now, I mentioned Gomis spent the night in hospital for further tests. What would a doctor want to know before allowing him to play elite sport again?
So I'd like to see that he has a normal electrocardiogram, that is an ECG that's taken from stickers on the chest. I'd like to see that he has a normal echocardiogram, which measures the pump function in the heart, and I would like to see his pump function being completely normal. In a situation like him, we may perform a tilt table test where we lie Mr. Gomis flat, tilt him upright, and try and provoke a stress response that causes him to pass out, i.e. provoke the vasovagal syncope episode that he had on the pitch. This is diagnostic, and in understanding the blood pressure and heart rate changes that we do see, we'll be able to be very reassuring with the diagnosis and give him conservative advice. The management of vasovagal syncope is usually conservative, that is, hydrate, being aware of the condition that can cause vasovagal syncope, such as lack of sleep or stress, and then avoiding precipitating factors, such as if you're aware that you have a tendency or you're undergoing a stressful period, the decision might be made not to play, or, for example, not to get on the underground carriage where it's warm and hot and stuffy.
And finally, is this a curable thing or can it just be regulated?
So patients with vasovagal syncope typically have 1 or 2 or 3 episodes in their lifetime, precipitated by a whole series of conditions that come into being. Most of the time, patients learn to live with the condition in that they avoid the stressful trigger, as I've discussed. So in all likelihood, Mr. Gomis, now that he's aware of the condition, or he has been aware of the condition, if he can manage the stress levels and continue to make sure he's hydrated and have a good night's sleep prior to a game, it should be possible for him to continue to engage in sports at a high level.
Dr. Boon Lim, thank you so much for joining us this afternoon. We really appreciate your insights.
You're very welcome. Thank you.